This podcast is for educational purposes and does not replace individualized medical care.
Episode 4, Estrogen-Responsive versus Estrogen-Related. In the world of wellness marketing, estrogen is often presented as a magic wand. People are told if they just fix their hormones, their sleep will return, their weight will drop, and their mood will stabilize instantly. Precision matters. Today, we are looking at a powerful differentiator. Is a symptom estrogen responsive or is it just estrogen related? The core question is, will estrogen fix everything? Let's talk about where estrogen actually goes. It doesn't just stay in the pelvis. That we can agree upon. Estrogen has 3 main types of receptors: alpha, beta, and G protein coupled receptors. These are found in your ovaries, yes, but also in your brain, your heart, your bones, and even your skin. Because these receptors are everywhere, almost every change in midlife is related to the decline of estrogen. When estrogen levels drop, the systems these receptors support have to recalibrate. However, just because a system has an estrogen receptor doesn't mean that externally provided estrogen can turn it on past estradiol's decline. Estrogen-responsive symptoms, these are the classic symptoms that we know with high-quality evidence respond directly to estrogen-based hormonal therapy. The most common are vasomotor symptoms, known as your hot flashes and night sweats. For most women, adding estrogen is like turning down a thermostat. It's a direct response. Another clear-cut example is genitourinary syndrome of menopause. When the tissues of the vulva and the vagina lose estrogen, they become thin and dry. Replacing that estrogen locally is highly effective, and yes, it is a direct fix in most cases. These symptoms are biologically driven by the lack of estrogen. Therefore, estrogen fixes them. Then we have symptoms that are estrogen-mediated or estrogen-related. These are multifactorial. Take sleep. Estrogen may help sleep if your night sweats are waking you up. But if your insomnia is caused by anxiety, sleep apnea, or high cortisol, a patch won't fix it. Weight changes in midlife are often related to lifestyle and aging than purely to hormones. Estrogen might influence where your fat is stored, moving it towards the midsection because of the predominance of male hormones for a short period of time. But it is not the sole cause of weight gain. Mood and brain fog, these are also influenced by estrogen, but they are influenced by the sandwich generation stress. Caring for dependents simultaneously, children, aging parents, and sometimes coworkers. If we treat a lifestyle or stress problem with a hormone solution, we often end up disappointed. This is why I view hormone therapy as a tool, not an identity. If you're feeling overwhelmed and exhausted, estrogen might be a piece of the puzzle. But we must also look at your lifestyle prescription, food choices, stress management, and non-negotiable sleep hygiene. Do not miss these parts. That's called precision medicine. Looking at your case holistically is genuine care. Next episode, we'll talk about the other team members on this axis.